CMS 2025 answer key. Which of the following childhood epileptic disorders often needs long-term treatment with anti-epileptic drugs? So that is your juvenile myoclonic epilepsy. Because benign neonatal seizures and febrile seizures, you won't need any long-term therapy, and benign Rolandic epilepsy is self-limiting. Which of the following are clinical features of Parkinson's disease? You have to select the answer. It's a multiple choice question. So, first is reduced eye blinking. You see that. Second is drooling of saliva. That is also present. And third is soft voice. That is also present. They have micrographia, which is small handwriting. So they do have a soft voice. A 35-year-old female presents with fatigability. Investigation shows that hemoglobin is 6%. Red cell morphology uh, is normocytic, normochromic, and reticulocyte production index is 5.5. Which one of the following conditions favor this abnormality? So this is intravascular hemolysis because it is not macrocystic, which cytic, which is seen in folate deficiency, and iron deficiency and sideroblastic, that is a part of the microcytic. So normocytic, normochromic with increased reticulocyte is your intravascular hemolysis. A 46-year-old lady on vegan diet for a decade presents with chief complaints of tingling and numbness in the lower limbs for 2 months and has a history of swaying while walking through narrow corridors. Which one of the following blood tests is advisable for diagnosis in this patient? So that is vitamin B12 levels. Which one of the following causes low volume erythrocytosis? That is Gase-Box syndrome. Gase-Box syndrome. It is pseudopolycythemia due to plasma volume contraction. That is your Gase-Box syndrome. You will have low volume erythrocytosis. First line therapy in chronic phase of chronic myeloid leukemia is imatinib. Rituximab is the CD20 depleter used in B-cell malignancies. Thalidomide is multiple myeloma. So the first choice is imatinib. With regards to management of idiopathic thrombocytopenic purpura, consider the following statements. All patients with ITP with platelet count less than 100 raised to 10 raised to 9 liter should receive high dose of glucocorticoids. It is not all patients that should have this. For patients with spontaneous bleeding, 40 milligram of dexamethasone daily is indicated for 4 days. We have to find the correct statement here. The correct statement is second one, which is patient with spontaneous bleeding. 40 milligram of dexamethasone daily is indicated for 4 days. Then third statement is also correct, that is IV immunoglobulin can raise the platelet count. And fourth is life-threatening bleeding should be treated with platelet transfusion. That is also correct. The wrong one is the first one. The limit is 30 into 10 raised to 9, and not all patients. Which of the following drugs can cause secondary weight gain? This is a multiple choice question. The correct answer is 1 and 2 only. Insulin and propranolol can cause secondary weight gain. Orlistat is drug of choice for obesity. Thyroxine is drug of choice for hypothyroidism. Most common symptom is obesity in hypothyroidism. That's so insulin and propranolol can cause weight gain. Under which one of the following conditions the HPA excess suppression is likely to result in crisis due to adrenal insufficiency following withdrawal of glucocorticoids? The answer is if glucocorticoids have been prescribed repeatedly within the previous year. Wilson's disease has which of the following inheritance? It is a autosomal recessive kind of inheritance, Wilson's disease. Which of the following can be used for the management of severe hyperkalemia? So IV calcitonin is for severe hypercalcemia. Yeah, IV sodium bicarb can be used. Oral sodium polystyrene sulfate, sometimes it's used. And IV calcium gluconate is also used. The answer is B. Which one of the following conditions can cause euvolemic hyponatremia? So the answer is hypothyroidism. Hypothyroidism can cause euvolemic hyponatremia. Adrenal cortical failure, nephrotic syndrome, and Burns causes hypovolemic hyponatremia. Which one of the following is correct regarding arginine vasopressin antagonist tolvaptan? So you have to find the correct statement. It is useful in hypovolemic hyponatremia. It antagonizes V1 receptor. It should be used for at least 1 year. It is an oral drug. So the correct answer here is it is an oral drug. Which of the following conditions is caused by the mutation in the gene that encodes sodium potassium 2 chloride cotransporter and presents with sodium wasting, hypokalemia, hypomagnesemia, and hypercalciuria? So this is your Bartter syndrome. Sodium potassium 2Cl is present in the thick ascending limb, and the mutation in it causes your Bartter syndrome. So you will have your sodium wasting, hypokalemia, hypomagnesemia, and hypercalciuria. A 52-year-old male has uncontrolled diabetes. Which one of the following tests will help in early detection of nephropathy? You can do urine albumin. Microalbuminuria is the earliest marker for detection of nephropathy. Autosomal dominant mutations in which one of the following genes may cause focal segmental glomerulosclerosis associated with abnormal genitalia, Wilms tumor, mental retardation? It is the Denny-Dress syndrome, and the gene is WT1. So, autosomal dominant, focal segmental glomerulosclerosis, abnormal genitalia, Wilms tumor, mental retardation is your WT1 syndrome. Euvolemic hyponatremia, so the volume is normal, but the sodium is less, is seen in hypothyroidism and SIADH. Hypothyroidism and SIADH. In SIADH, the drug of choice is tolvaptan, which is a V2 receptor antagonist. Kidney damage and GFR value between 15 to 29 are found in which stage of kidney disease? So this is your KidneyCo guidelines, and this is stage 4 severe disease. So we will try to remember that staging. So GFR less than 15 is grade 5. Grade 4 is 15 to 29 as asked here, which is grade 4. So grade 4 is 15 to 29. The first option, grade 2, would be 60 to 89, and 3A would be 45 to 59, and 5 will be less than 15. Which of the following hereditary tubulointerstitial kidney disease has an autosomal recessive mode of inheritance? That is nephronophthisis. That is autosomal recessive, nephronophthisis. What is nephronophthisis? It is a genetic kidney disorder characterized by inflammation and scarring, fibrosis of the kidneys, leading to progressive kidney failure. The term nephronophthisis literally means disappearance of nephrons. It is a form of renal ciliopathy. It involves defects in primary cilia, which are structures involved in various signaling pathways. You see progressive kidney failure, cyst formation, tubulointerstitial nephritis. So that is autosomal recessive. Other autosomal dominant is medullary cystic kidney disease type 1 and type 2, and juvenile hyperuricemia nephropathy. Which of the following findings in a patient are suggestive of acute nephritis? Hematuria, it is seen. Oliguria, yes. Reduced size of both kidneys is seen in chronic kidney disease, so that is the wrong option. And you can see edema. So here the option is D. A 35-year-old male patient with increased urine output. On evaluation, his urinary output was around 4 liters per day. Urinary osmolarity was 200 milliosmoles per liter. Which of the following are various differential diagnoses? Psychogenic polydipsia, solute diuresis. But in solute diuresis, you will have increased urine osmolarity. Central diabetic insipidus and nephrogenic diabetes insipidus. So all three options are correct except second one, because in solute diuresis, your urine osmolarity will increase. So the correct answers here is psychogenic polydipsia, central diabetes insipidus, and nephrogenic diabetes insipidus. Normal urine osmolarity is between 50 to 1200 osmoles per kg. Contralateral homonymous upper quadrantopia is a type of visual loss seen when the lesion is located at which level of the following anatomical locations. So contralateral homonymous upper quadrantopia is your temporal lobe. Contralateral, so opposite to the side of the lesion, and the pie in the sky appearance is your temporal lobe. Which of the following are clinical features of migraine? It is associated with dilatation of extracranial vessels. No. Common migraine is seen without aura. Yes, it will be the complex one. Aura is most often visual. That's also correct. So the only wrong option is that it's associated with extracranial vessel dilatation. A 50-year-old man presents with brief episodes of lengthening unilateral facial pain involving the buccal distribution. Pain is triggered by washing face with cold water. What is the most likely diagnosis? This is trigeminal neuralgia. Which of the following are trigger factors for seizures? Sleep deprivation, yes. Missed doses of anti-epileptic drugs, yes. Recreational drug misuse, yes. Physical exhaustion, yes. All are trigger factors for seizures. Consider the following pleural fluid analysis. pH is higher, 7.6. Pleural fluid protein is 0.5. Serum total protein is 6.5. So serum protein is more. Pleural fluid LDH is 100 and serum LDH is 300. So what is the most likely diagnosis here? It is myxedema. It is a serious type of pleural fluid. The others, like pancreatitis, sarcoidosis, rheumatoid arthritis, they show ex Mason bodies formed due to proliferation of immature collagen are a characteristic histopathological finding seen in which of the following conditions? Mason bodies are seen in cryptogenic organizing pneumonia. Mason bodies are immature collagen and they are seen in cryptogenic organizing pneumonia. Consider the following statements regarding respiratory function in old age. So we have to find the correct statements. There is an increasing ventilation perfusion mismatch. That is correct. There is an increased ventilatory response to hypoxia and hypercapnia. Okay, that's correct. There is a decline in maximum oxygen uptake, leading to reduce in cardiorespiratory reserve. That is wrong. There is a decline in the forced expiratory volume to forced vital capacity ratio by around 0.2% per year after the 40s. That is also correct. Old age lung functions reduce, so volume reduce, and so reflex also reduce. The correct statements are 1, 2, and 4. Increased VQ mismatch and reduced FeV1 by FVC ratio. Which of the following statements is correct in response to pulmonary involvement in rheumatoid disease, which is your Kaplan syndrome? So that is the correct statement. Combination of pleural effusion and pneumoconiosis in these patients is known as Kaplan syndrome. Let's read the other options. Rheumatoid pulmonary nodules are usually asymptomatic and detected incidentally on imaging. Rheumatoid pulmonary nodules are often solitary, they are multiple. Uh, Pleural effusion in these patients are transudative, no, it's exudative. In all autoimmune disorders, you will have multiple nodules in the lungs. Which one of the following conditions is a complication of bacterial pharyngitis involving extension of infection into the internal jugular veins, leading to thrombosis and metastatic dispersal of the organism? So, what would be the complication of bacterial pharyngitis? Lemierre's syndrome. It is called Lemierre's syndrome. Lemierre syndrome is a rare, potentially fatal condition that occurs when a bacterial throat infection spreads to the internal jugular vein, causing thrombophlebitis. It's usually caused by an aerobic bacterium, a Fusobacterium necrophorum, and typically affects healthy young adults and teenagers. The infection spreads from the throat through the tonsillar vein, causing septic thrombophlebitis in the internal jugular veins, and that is your Lemierre's syndrome. A 42-year-old man with history of alcohol dependency presents with progressive abdominal distension. Abdominal examination reveals a shifting dullness. Which one of the following is the most appropriate drug to relieve the abdominal distension? The drug is spironolactone. There is no bleeding varices, so no octreotide. Propranolol is used in the prevention of bleeds, and lactulose is used in hepatic NCAF. But for hepatic ascites, you have to use potassium-sparing diuretics such as your spironolactone. Which one of the following is the investigation of choice for diagnosing the presence of stones in the gallbladder? That is your transabdominal ultrasound. Because all stones you will do NCCT, but for gallstones you do ultrasound, and the other stones like the common bile duct you can do ERCP or MRCP. Which one of the following biologic agents used in the treatment of IBD acts by inhibiting the enzyme Janus kinase? So I remember it as TOFA. So your Janus kinase inhibitor and IBD disease is your tofacitinib. Melanosis coli, which occurs due to long-term consumption of stimulant laxatives, presents as brown discoloration of colonic mucosa due to deposition of which one of the following pigments? It is lipofuscin pigments. Consider the following with regards to Gilbert syndrome. Autosomal recessive trait of a mutation in Gene for UDP glucuronidase transferase enzyme. That's correct. Elevation of unconjugated bilirubin. That's also correct. Because conjugated you see in doctors, so DNR, Dubin Johnson and Roters. Gilbert you'll see non-conjugated. No stigmata of chronic liver disease other than jaundice. That is also correct. Early liver biopsy recommended in patients with possible Gilbert syndrome. We don't do the biopsy. The single most important treatment and prognostic factor in alcohol-related liver disease is you have to stop the alcohol first. That is the most important. A 40-year-old man with a known case of chronic pancreatitis presents to the OPD with complaint of skin pigmentation over the abdomen. The patient gives a history of chronic use of a hot water bottle to relieve the abdominal discomfort. Which one of the following is the most appropriate diagnosis? Erythema infectiosum is a viral infection. Erythema marginatum is seen in rheumatoid arthritis. Erythema nodosum is skin reaction to inflammation. So this is erythema ab agni. Erythema ab agni. Erythema ab agni, also known as hot water bottle rash or toasted skin syndrome, is a skin condition caused by long-term exposure to heat. Prolonged thermal radiation exposure to the skin can lead to the development of reticulated erythema, hyperpigmentation, scaling, and telangiectasia in the skin. So, ap acne is your skin condition due to long-term exposure to heat. Which one of the following heart sounds are best heard with the bell of a stethoscope? That is your opening snap and your mid-diastolic murmur. Which two sounds? Your opening snap. I'm sorry. So the sounds which will be heard best with the bell of the stethoscope is third heart sound and mid-diastolic murmur is your third heart sound and mid-diastolic murmur. Which sounds are heard best with the bell of your stethoscope? Third heart sound and mid-diastolic murmur. Consider the following statements for diagnosing ventricular arrhythmia aneurysms in a patient with recent MI. How will you diagnose a ventricular aneurysm? First, paradoxical impulse on chest wall. Yes, correct. Persistent ST elevation on ECG. Okay, that's also correct. Unusual bulge from cardiac sellout on X-ray. That is also correct. Presence of pulsus paradoxus. That is incorrect. Pulsus paradoxus is present in cardiac tamponade, but not in ventricular aneurysm. So the correct option here is 1, 2, and 3. Which one of the following statement is correct for subcutaneous nodules in rheumatic fever? They are also present on the flexor aspect of forearm. So rheumatic fever nodules are actually present in the extensor surface. This is wrong, and we only have to find one correct statement. They are painful. They are not painful. Rheumatic fever nodules are not painful. The usual size of these nodules is 3 to 5 centimeter. Okay, let's keep reading. They typically appear more than 3 weeks after onset of other clinical manifestation. This is correct. So you will see the other clinical manifestations first. It would be close to 3 weeks, and then you will have your rheumatic fever nodules. Which one of the following is correct with regards to Carey Coombs murmur? Uh, the option correct is B. Soft mid-diastolic murmur due to mitral valvulitis. So Carey Coombs murmur is your mid-diastolic murmur. It is soft and it is seen in mitral valvulitis. Let's see the other options. Soft systolic murmur due to mitral regurgitation. That's not Carey Coombs. That is acute rheumatic fever and seen in mitral wall regurgitation. Harsh early diastolic murmur due to aortic regurgitation. The other options are incorrect. The correct one is B. Which one of the following statement is correct regarding the opening snap in a patient of mitral stenosis? So this is a repeat question. It was asked in FMG. Opening snap moves closer to the second sound as the stenosis becomes more severe. Opening snap is best heard with the bell of the stethoscope. That's not correct. We just learned that with the bell of the stethoscope, what is heard best is your third heart sound and your mid-diastolic murmur. Third heart sound and mid-diastolic murmur is the bell of the stethoscope. Whereas for the opening snap, you have to use the diaphragm. Uh, Option D is opening snap is best heard at the second intercostal space, left intercostal space. So the pulmonary valves are generally spared, so you won't be hearing anything in the left intercostal space. This will be option C here for the repeat question, direct repeat question. Which of the following responses to IV adenosine is correctly matched? So if you give it an AV nodal reentrant tachycardia, AVNRT, most common of which is paroxysmal supraventricular tachycardia, it will cause termination. So the correct option is AV NRT. You give IV adenosine, it will cause termination. Consider the following steps for using MDI. And now you have to set them in the correct sequence. So the first step is remove the cap and shake the inhaler. Third is after that, what you will do is breathe out gently and place the mouthpiece in the mouth. After that, incline the head backward to minimize oropharyngeal deposition. After that, simultaneously begin a slow, deep inspiration, depress the canister, and continue to inhale. And the last step is hold the breath for 10 seconds. Under the stepwise approach to the management of bronchial asthma, which one of the following is the correct initial treatment as step 1 for patient diagnosed with asthma? So that would be your low dose inhale corticosteroids only. So first step up therapy, we will see. First step is mild, low dose inhalational corticosteroid therapy. Then comes moderate. In moderate, you will increase the dose to medium and you will add a long acting beta agonist. Then this is your moderate. Then one step up, severe. You will give high dose of inhalational corticosteroids and you will give LABA as well. And then fourth step is your refractory asthma. There you will start oral corticosteroid prednisolone. And the fifth step, last step, is your corticosteroid resistant asthma. There you will do the monoclonal antibodies. So step one is your mild, which is asked here. You will give inhalational corticosteroids. Step two, you will increase the dose and add a LABA. Then step three is your severe. You will give high dose steroid and a LABA. Then step four is your refractory. You will give oral prednisolone. And step five is resistant to steroids. You will give monoclonal antibodies. So let's see the other steps. Low dose inhaled corticosteroid plus oral. So oral is seen in your step number 4, refractory. Low dose inhaled steroids plus long-acting antimuscarinic agents. Low dose inhaled corticosteroids plus leukotriene antagonist is your step 3. Only low dose inhaled corticosteroid, step 1. A 62-year-old male chronic smoker has been diagnosed with chronic obstructive pulmonary disease. On pulmonary function testing, the ratio of FEV1 to FVC was 0.6 and FEV1 was 70%. What is the severity of airflow obstruction in this patient as per Gold's criteria? It is moderate. This comes under moderate uh, Gold criteria because the FEV1 is 70% and FEV1 to FVC ratio is 0.6%. Let's see all the criterias. So there are 4, 1, 2, 3, and 4. They are called mild, moderate, severe, and very severe. The ratio is less than 0.7 in all of them. The only thing that will change is the predicted FEV1 percentage. So for mild, remember it is more than 80, little less, 30 less. So 50 to 80 is in 2, then subtract 20. So 30 to 50 will be in 3, and less than 30 is 4. So it is easy to remember. 1, 2, 3, 4, mild, moderate, severe, very severe. FEV1 to FVC ratio is less than 0.1 in all of them. So the only thing changing is your predicted FEVC percentage. So more than 80 is mild, then subtract 30. So 50 to 80 is moderate, then subtract 20. So 30 to 50 is severe, and less than 30 is your very severe. Which of the following correctly denotes the inheritance pattern of cystic fibrosis? So it is CFTR, gene mutation, autosomal recessive. Which of the following conditions are contraindications for non-invasive positive pressure ventilation in patients with respiratory failure? We have to find the contraindications for non-invasive respiratory positive pressure ventilation. Craniofacial abnormalities, it is a contraindication. Significant burns, it is. Respiratory failure with partial CO2 of 60 mmHg. This is seen in COPD, and COPD is actually the most common indication for non-invasive positive pressure ventilation. Cardiovascular instability. That is our indication for non-invasive positive pressure ventilation. So let's see what are the contraindications for NIV, such as BiPAP and CPAP. Is your respiratory or cardiac arrest, severe encephalopathy or altered mental station, hemodynamic instability, facial trauma or surgery, upper airway obstructions like laryngeal masses or tumors, inability to clear secretions, active vomiting, impending intubation, gastrointestinal bleeding. These are all absolute contraindication. Even if you're thinking that they will require it for a longer time, then also you don't go for it. That is a relative contraindication. Which one of the following terms denotes the extensive sclerosis of the skin of the chest wall, which restricts chest wall movement and is seen as a rare complication of systemic sclerosis? This is hindbound chest. Hidebound chest. As if leather is around the chest, hidebound chest is seen in systemic sclerosis. Flail chest is multiple rib fractures. Barrel chest is seen in COPD. And pigeon chest is seen in rickets. Okay, so there are total uh, the total number of questions is 100. I'm sorry, it's 120. We'll do up to 60 in this session and the other 60 in the next session. Which one of the following statement is correct in the diagnosis of giardiasis? Giardiasis. Stool sample at 2 to 3 days interval should be examined for cyst. That is correct. In clinical assessment of an elderly patient, the get up and go test is used to evaluate which of the following: gait and balance. Get up and go. You see gait and balance. Treatment of choice for acute gout is oral colchicine. That is your first choice. And then is NSAIDs. And then is corticosteroids. A 56-year-old male came with acute onset breathlessness and found to have pneumothorax. The resident doctor decided to insert intercostal drain. Which one of the following sites is suitable for such a procedure? It's the triangle of safety. Which one of the following is an antidote for rivaroxaban and apixaban when reversal of anticoagulation is needed due to uncontrolled bleeding? So the answer also will have an XA in it, that is adixanet alpha. Which one of the following are included in common causes of mediastinal masses in superior and anterior mediastinum? So one, goiter, and two, thymic tumor. If it had been posterior mediastinum, then we would have answered neurogenic as well. So the answer is A. Goiter and thymic tumor is the common causes of mediastinal masses in superior and anterior parts. Which of the following is used to reverse the anticoagulation effects of dabigatran? So Debi is your Daru. So idarucizumab is your reversal of anticoagulant effects of dabigatran. Which one of the following is contraindication of doing a wireless capsule endoscopy. You cannot do it in a stricture. That is a contraindication. If there is a stricture, then you cannot do wireless capsule endoscopy. Which one of the following is a causative organism of erythrasma? A mild, localized, and superficial skin infection is your Corynebacterium minutissimum. Which one of the following is correctly matched regarding the classification of portal hypertension according to the site of vascular obstruction? Okay, let's see. Correct is prehepatic presinusoidal portal vein thrombosis. Schistosomiasis would be your sinusoidal. So the only one correct here is also prehepatic portal vein thrombosis. Which one of the following is a secondary cause of headache? Medication overuse headache. This is also a repeat question. That's a secondary cause. A 32-year-old man presents with history of recurrent jaundice over the previous decade. Family gives history of the patient having episodes of facial grimacing. Which one of the following is a climate clinical clue of the diagnosis? Anytime a young patient with such symptoms, neuropsychiatric symptoms, you have to think about Wilson's disease, pressure rings in the cornea. Jaundice plus neurological involvement is equal to Wilson's disease. We'll do the rest in the next video.